Hi, and welcome back to another episode of Rotator Cuff Expert. So this is going to be our last, I think anyway, our last episode for nutrition after rotator cuff repair after surgery. This is post-op nutrition number 4. Remember, we did 1, we did 2, we did 3, and then I did 3B as a tutorial of how to calculate the calories and the protein and the fats and the carbohydrates. And so now this is our last video. We're going to talk about the micronutrients, the vitamins and the minerals, okay? So the big caveat, big warning sign, warning, ask your doctor, whether it's your primary care doctor or your orthopedist or both, ask them if it's safe to take these because there are certain things that are not safe to take. For example, omega-3, 6, 9 fatty acids. The generalized, we recommend 1,000 milligrams. However, if you are on a blood thinner, this will potentiate or magnify the effects of the blood thinner. So before you take any fatty acids, you need to make sure you talk to your primary care doctor or your orthopedist to make sure it's safe for you to do that. Now, vitamin C, vitamin D, zinc, not quite as important, meaning they're safer. Zinc, we look at what do these things do? Okay, let me step back for a second. Vitamin C. So vitamin C, the good thing about vitamin C is water soluble, which means it will flush out. So technically you can't get too much, although I'm sure you can get too much, so don't try that. Okay, vitamin C, somewhere about 500 to 1,000 milligrams a day. Vitamin C, everybody knows vitamin C, orange juice, citrus fruits, broccoli, all is good vitamin C. So again, after you talk with your doctor and that says it's okay for you to take vitamin C, that's about generally what we'd recommend after surgery and probably in general for a diet. C is a really good antioxidant, okay? So that's why people in general want us to take C whether we're having surgery or not. A good antioxidant, so a good inflammatory minimizer or anti-inflammatory type, right? Free radicals, you go all the way down the road about that. But anyway, it's a good anti-inflammatory for your body. You're going to have a lot of inflammation after surgery, so we want to make sure that you have a good amount of vitamin C in your system to use that vitamin C as an anti-inflammatory to suck up the bad stuff that's creating inflammation, okay? Vitamin D and calcium. Vitamin D and calcium work together, right? Vitamin D helps the gut suck up calcium, okay? So we need both vitamin D and calcium in our diet. So vitamin D, 600 international units, 1,200 milligrams of calcium. That's kind of the general ratio. There's some that people say more or less, depending exactly on the situation, how old you are, if you're male or female, if you have osteoporosis, don't have osteoporosis. So in general, this is a reasonably safe dose for you, and it makes sure we get enough calcium and vitamin D to be able to have good bone health. Now we say, well, why do I need bone health? I'm having a rotator cuff surgery. Well, the rotator cuff attaches to this spot here on the ball, which is bone. So we need the rotator cuff tendon to heal onto the bone. So we need good bone health, okay? So vitamin C, vitamin D, bone health, zinc. Zinc is really good for bone formation. Again, make sure you talk to your doctor. Make sure it's okay for you to take zinc before you take zinc, okay? So it's really important. We can get zinc usually from supplements. You can get zinc from some seafood too, but usually it's hard to get enough. And it's hard to figure that out. So most of the time, if you're gonna have zinc, if you're gonna use zinc, you're gonna have a supplement of zinc, okay? Same with vitamin C, usually you're gonna have a supplement of vitamin C. Vitamin D, calcium. Vitamin D, probably a supplement, especially more northern climates where you are not in the sun a lot, or if you're working in the office and you don't have much exposure to sun, vitamin D gets triggered by the sun, so we need the sun. And if we're not getting enough sun, then certainly a vitamin D supplement makes sense. And calcium, obviously calcium from dairy products, yogurts, cheese, milk, that kind of stuff. But you can, most of the time, especially in our normal diet, that we're probably gonna need a calcium supplement too. But again, ask your doctor about vitamin C, about vitamin D and calcium, about zinc and omega fatty acids. So sometimes people talk about taking fatty acids if you have high cholesterol. So those fatty acids can sometimes be protectant. Or increase the good cholesterol. Again, that's not why we're using it here. We're using it here in shoulder rotator cuff repair recovery because it will decrease the inflammation. But if I didn't say this enough time, I'm gonna say it one more time. Please ask your doctor Is it safe for me to take vitamin C? Is it safe for me to take vitamin D? Is it safe for me to take zinc? Is it safe for me to take omega fatty acids? Because we want to make sure that it's safe for you. Again, the biggest thing, the fatty acids, and it's in their the way they potentiate or increase the effects of blood thinners. That's super important. We don't want to have extra bleeding after surgery, okay? So check on that. Now there are a whole host, as everybody knows, a whole host of other things, right? Other supplements that are out there that promise this or that or this. These are the things that are really more proven in the medical literature. The things beyond this are just that, beyond this. So I'm not saying that there might not be another supplement that might help you as well. I just don't feel comfortable recommending anything other than this because these are more backed by science and more backed by medicine. Hope that makes sense. And so this is our last episode, unless there's someone else that asks me a question about nutrition after surgery. So please like this, please make comments, tell me about what you think. Tell me about what other episodes, what other things you want me to talk about so that I make sure that I give you the content that you want and that you need. If you're recovering from shoulder surgery, good luck. And if you have any problems or questions about that, please let me know, whether it's directly about the videos or just in general through the email, through the website, mybodyprotector.com. However you want to get a question from me, I'd be more than happy to answer it. Thank you and have a great day.